What's up, guys? Welcome back to Champ and the Tramp. This episode is brought to you by Bubba Coos Burritos. Frank, how do you like Bubba Coos?
Bubba Coos is my go-to spot for lunch, sometimes dinner. You can't miss with Bubba Coos. My kids love it. Everybody in the family is down with Bubba Coos.
Check them out, Bubba Coos Burritos.
Real show, here we go. Real show, here we go. You know that it's gotta be that time, so this is what we chant. What keeps on getting them all amped in advance? Come on. You and I rocking out with Iron Man, F.E. You get the general's point of view on top of Roger's rants. We're never tapping out, we're putting the most minutes in. You already know what that's about, you know that winners win. Crush whatever's on task, check the podcast. It's the Champ and the Tramp, let the bomb blast.
What's up, everybody? Welcome back to Champ and the Tramp. We got special guests from Garden State Medical, Dr. Jani, Dr. Trontis. I reached both orthopedic doctors, right? Correct?
Well, I do pain management.
Pain management.
And he's an orthopedic surgeon.
I recently just got treatment there. Got a PRP shot on my shoulder 3 weeks ago. Feeling pretty good, doing all right. And thanks for having us, man. Or thank you for coming on.
Excuse me, I think it's me. Thank you for having me.
Yeah, no, thanks for coming on. Obviously, what you guys are doing is pretty good stuff. Very interesting stuff for me, being an athlete. Roger definitely being beat up in his old age. I'm sure he could use some knowledge from you guys, and just some of our listeners, I'm sure, be into what you guys are into as well.
No, for sure. Thank you for having us. There's a lot of overlap between what you guys do and what we do, right? I mean, at the end of the day, when you guys get hurt, you guys show up in our office. And for a lot of us, our goal is hopefully to keep you out of our office, right?
Yeah.
We, ideally focus on exercise, nutrition, all that kind of stuff, and hopefully keep you guys out. But at the same time, at the level, especially you're performing at, it's going to happen, right? It's impossible to not get injured if you're at that level, right? And so it's a matter of, well, how do you get back to it as soon as you can in the safest way you can,
Right, yeah.
For sure, and you got to look around the professional athletes in all disciplines. Who do you know who's never had surgery, who's ever had an injection? There are some guys who get an injection before every game or before every time they go out.
That's true.
And then, a lot of folks end up getting real surgery because they need it. They miss a season. They do it in the off season, but it's got to happen. You play long enough, you treat your body like that, you're going to need it eventually. Hopefully not, or this guy keeps you away from it. But when you need it.
Well, I always say, people are like, fighting, you had how many surgery, you have this and that. And I'm like, dude, my dad's a plumber, bro. He had a bunch of surgeries too. You know what I'm saying? So.
No, but I mean, that's a lot of our patients too. A lot of these guys, union guys, working tough jobs, and they beat up their body, HVAC guys, plumbers, you know what I mean? You do it to yourself over 30, 40 years, it's going to catch up to you no matter what, And
you know what? You sit at a desk long enough, you do the opposite of that, you got some kind of other problem. You get something else injected. There's nobody gets away with it. You can't survive and not need something.
Just part of the aging process, kind of, right?
Yeah. I don't think we were meant to live past 40.
Medicine has enabled us to live past our life expectancy, really, kind of, right?
I mean, that's a big part of it too. At the end of the day, we keep pushing how long people are surviving, how long people are living, and we try and keep them going, but bodies do break down too.
Doesn't it come down to really? I don't know. I mean, you guys are doctors. I'd be interested to hear your perspective on it when Frankie's done kicking stuff. But doesn't it come down to quality of life? I mean, is that what it really is about? I don't want to live beyond my quality of life. When I'm pooping my pants, it's time to go. Maybe people would disagree and want to live to their last dying breath, but
there was a study that showed most doctors choose to be DNR, DNI, right? Like towards the end of their lives, like, nope, don't do any of that stuff to me, right?
Because they've seen it all.
Yeah, right? I mean, and the outcomes show that, the chance of having meaningful recovery and good quality of life after something like that is pretty low to begin with, right?
Right.
And so, I mean, I've had that conversation, and I think that's important, for everyone to have that conversation with loved ones and parents and whoever. So that way you're not struggling to make that decision when that comes, because it's going to come, right? I mean, nobody outlives Father Time, right?
Sure.
So it's important that you have those conversations with loved ones too, because it's tough to be in that situation, never having talked about it or whatever. And the predisposition is just do everything, right? Like go. And really, having seen what I've seen, I wouldn't necessarily recommend that for everyone,
And not that it's financial, not that you should ever make a decision, should we intubate this guy, should we do the surgery based on money, but 80% of most people's lifelong healthcare expenditures are in the last 20% of their life. Because it becomes this inordinate effort. It's not about the money, it's the investment. People are in the hospital half the time. They're getting this surgery that didn't go well, so they need another surgery, or they got this procedure done, they got intubated, they got this thing, and now they're going to live for another 10 years. But every other week they're stopping in to see a doctor. They got to go back into the hospital or something like that. Yeah. It is about quality of life.
Sure.
And the reason to check in with doctors is you poop in your pants. You know, you don't know if it's the end or if it's some stupid little thing that we can just fix and then you're 100% back. Right. And you got to build rapport. You got to build trust with the doctor to understand, help you make that decision. Because if it's an easy thing and you're better, I'm going to tell you to do it. Right. If it's something that's going to ruin the last 5 years of your life, I'm going to hopefully tell you not to do it. It's the gray zone where I got to know what your priorities are. Mm-hmm. You as a patient have to communicate, hey man, I'm here for a good time, not a long time. I want the least that you can do to get me the most out of it. Mm-hmm. We got an answer for that. Yep. Sometimes if you say, no, I just want to be 110. All right, we got an answer for that too. You just may not like it, but as long as we set expectations, you know what you're getting.
It's not one size fits all. Every patient is an individual, and you cater to their wants and needs, I guess, right?
Yeah. There's few things where you see it on an X. You can see a lab, you see an X-ray, you see a whatever, and you go, well, I know what's next. I know exactly what we need to do because everybody needs it. Shy of that, it's all about what you want. You are as much patients as you are consumers of healthcare. What do you want to get out of the experience? If I'm I'm not going to save your life. If somebody's going to save your life, they're going to do it no matter what. But what do you want to get out of it? Right. Why are you here? If you showed up in the hospital, are you in pain? Do you want to not be in pain? Right. Should you show up in my office because you want a back surgery because you think you're going to wrestle again when you turn 75? You got to have expectation setting.
Realistic ones too, I guess.
Yeah.
No, but it's also good in our specific setup where we can bounce patients off each other where, hey, look, this guy I think needs surgery. I've tried this. I have done that. We've sent him PT. We've done him this. Send him over to him. Sometimes he'll say, no, they don't need surgery. I don't think they're ready. They could do this. They could do that. Versus, he has patients show up and they're like, doc, I need back surgery. He's like, dude, you haven't even done physical therapy. Like, what are you talking about? So it's good that we can, help take care of these patients appropriately and kind of get them what they need.
Here's maybe a little insider question. I'm not sure if you can answer it, but guys seem like straight up guys. Is some of that governed by insurance? Does insurance make you go through certain? You can't just go in and see somebody clearly is in bad shape and say
no. If someone's like if they have paralysis, if they have serious neurologic problems, he could speak more to this. Right. Then you can bypass everything and just
typically
do it.
From a guy who's dealt with a lot of back issues. Yeah. Typically, they want you to get the epidural injections first, right? And then they want you to do
There is a part of
therapies.
Yeah, I mean, some of this is cookbook medicine, and that's the way I explain it to patients. Like, unfortunately, there's three parties here. You're the patient, I'm the doctor, and you have your insurance company paying for it, right? And so they get a say too. Right. And unfortunately, they have these certain protocols, but most of them are rooted in pretty good medicine. Science, what I mean? It's not like made up out of nowhere. Mm-hmm. I will say though, specifically people who are injured in like workman's comp injuries, that, like, I don't believe in those treatment protocols. Like, those are not meant to help people.
Oh, is that
in
right?
my opinion?
Really?
No. But like the other, like most of your commercial insurance.
Explain that. What do you mean? I think I know what you're saying, but
no, but in my opinion, I mean, we don't really do a lot of workman's comp. But, what I see is they just drag out care and just don't want to approve things. And hey, like 12 weeks later, maybe you'll get some physical therapy. Like, no, man, you needed that 3 months ago, right? Like what just 3 to 6 months always behind of what a patient needs, right?
The work comp MO is just delay care until someone just happens to get better. Gotcha. Even if that takes 5 years.
Well, it's just insurance companies in general, right? You got to pay insurance, and then when it's time to collect, they're like, oh, we're not paying you. Like, what do you mean? I've been paying this whole time. That's just their scam.
Right. And I'll never stand up for an insurance company, but if you look at the world through their eyes, to his point, you see where it's coming from. Sure. Let's assume I'm an idiot. Let's assume I don't know what I'm doing. Let's assume I'll do anything to get paid. That's the worst kind of doctor.
Sure.
Aetna, whatever, Medicare, there's 100,000 people in the country with back pain, and they basically just looked at their own patients for the last 10 years and said, those who had surgery, how many got better? Those who did therapy, how many got better? And so I don't know what I'm doing. I'm in it for the money. I'm a terrible person. I'm a bad doctor. I saw a patient. I said, you need surgery right away. Medicare is just going to be like, I don't know him from Adam. why don't you try some therapy? I know the patients who get therapy tend to do better. So you look at it from their way, you know where it's coming from.
Theirs is a numbers game. Yours is more of a personal.
I believe it was you guys that when we spoke a while back about my back issues and stuff, and I think you said MRIs didn't start until the 90s. Is that you guys telling me that?
Yeah, I mean, realistically, I mean, so I've done some research into like the history of back surgery and all that, and then you really look at it. 80s, 90s, X-ray, like, you know, we didn't really have this technology until like the real 1990s, and even then it was super expensive. Even now it's expensive, right? But imagine 30 years ago, right? And so you start seeing all these things, and people say, hey, we could fix that, but we didn't really understand that didn't really mean you were going to get better, right? But we did it because now we could. So the evolution of technology has driven some healthcare costs because we could now do things. But a lot of people never really took a step back and said, do we need to do this? Right? Like these people existed for years before we could take a picture of their back and see these things. And, you know, so it's interesting is in terms of an evolution of medicine combined with history and technology that you see that kind of where we're at, especially when you factor in not only just that, but then opioids and the opioid epidemic, like where that came from. Right. There's been a lot of advancements in medicine and technology, but it doesn't mean always people are getting better.
Yeah. What is it? Is it necessary? You know what I mean? Like, has it been? Are things being overprescribed just because it exists? You know, because like you said, there was a day and a time where there was none of this.
Yeah.
What did people do back then?
But don't they survived? If you MRI'd like 10 people walking down the street, more than half of them are going to have a herniated disc. Yeah, most of them. But not all of them are going to be in pain, though, right?
Yeah.
It depends on if it's not hitting a nerve.
I think that's what we talked about. Was that imaging findings? If I MRI'd your back and you had a real problem, the next level up there'd be something there too, and the one above that maybe not. Whatever. The older you get, the more of those things you get. The art of it, the art of medicine, is taking what you say, matching it to the imaging, matching it to whatever other information I have to say, that's messed up, that's messed up, that's messed up, but this is the one that you're complaining about. This is the reason you can't use your leg. This is the reason you got sciatica. We can fix that. Let's only fix that. Let's not fix the whole thing.
Yeah, right.
Pain is the big factor there. Everybody wants to be pain-free, right? And
right. So, for us, that's our thing, right? Aches, pains, no,
but I mean,
surgery.
you know, I tell a lot of patients, look, your body will figure some of this stuff out too, right? We're just trying to get you out of some pain for now until your body can heal itself too, right? Because there's some of that goes on too. So, you know, sometimes patients are eager, excited just to, you know, like, I need to get out of pain. Now, listen, we'll get it better, but I'm not making your body heal itself. Only, you know, kind of time and giving it some, you know, therapy, that kind of stuff is going to do that.
Yeah, I heard something back when I was going through all my back issues. Which I have definitely some severed nerves because I always call it Frankie makes fun of me. I got a baby calf on my left side because my whole interior calf is atrophied away from I think it was a botched surgery, really, my first surgery that I had when I was in Maine at 22. Maine.
It was up in Maine.
They did it with a chainsaw. It was done with a chainsaw.
I could have already told you that was going to be a bad outcome. He had surgery in Maine.
They rolled the elk out of the room so you could have back surgery.
I know. The moose was scrubbed in on the operation. The moose is handing the surgeon tools.
No, it was definitely a long time ago, and that's maybe we can talk about that a little bit and get you guys' take on that. So I jumped off when I was 22. I jumped 21, I think. I jumped off something called Kingsman Quarry, and it was about a 110-foot rock quarry. It was an old miner's quarry that they'd mined out, and they got down so low they hit water and it kind of filled up full of water, but it was about 100 feet to the top of it. I jumped off this thing. There was only a few kids that I guess had balls enough to do it. I did it, and I hated heights, but anyway, I did it. I got it on camera too. I could probably dig it up. And
fucking 8-track.
Yeah, Super 8. But when I landed, when I hit, of course it hurt a little bit, but I was fine. You know what I mean? I was just happy to be alive. And that was maybe like on a Saturday. Sunday came and went, and then like Monday morning came around. I was supposed to get up. You know, I worked for my dad at the time, and I literally couldn't get out of bed. I was just in so much wrenching back pain. It was like literally killing me. And my dad was like, you pussy, lay in bed a couple days and you'll be fine or whatever, you know. And it wasn't fine, you know. And I was in some serious pain. I knew something was wrong. But I went through all that protocol, all that regiment that I was talking about. You know, the first thing they did was, you know, they sent me to a pain specialist, and they wanted to do the epidurals. And I can remember laying there. The first one I ever had done, I remember laying, you know, you lay with your face through the hole. And he put that thing in, and I was already in so much pain when he squirted that in, I'm assuming that you already have a bulging herniated
Are you
disc.
talking about the shot?
Here we go. Here we go. Here we go.
He said he put it in, he squirted. I don't know. What are we talking about here?
I was awake, so I wasn't unconscious. So, but anyway, it just immediately caused more pain. And I was like, oh my God. And I remember I could barely walk to my car to get home. But I'm thinking, okay, this is gonna work. They tell me the lidocaine, cortisone, or whatever will reduce it. So I go home and it never subsided. It was just horrible. So then I started back then. That was when they would prescribe you Oxy 80s back then. This was I moved to Jersey in '98. So this is probably mid 90s. You know what I mean? And they were prescribing me Oxy 80s like it was nothing. And I'm not a pill guy either, you know what I mean? And I was popping these things like Pez just to get out of pain. So from that point, I was so young. I was 21. They didn't want to do surgery. He's too young for surgery. So I went in, and I guess this was probably in the early days of MRIs where they weren't that clear or whatever. I ended up getting scheduled. I remember they tried to get me to do physical therapy. I couldn't even do it.
Yeah, it just hurt
rubber
too much.
band, the ball stuff. I couldn't even do it. I could barely get to the therapy place. I was in that much pain. They did the surgery. And I was, being in that young mindset, and I was a healthy kid. I thought I was going to wake up and be immediately fine. I wasn't. I woke up and I was still in pain. I was still hurting. But my dad and the doctor was like, "It'll get better. Just had surgery. It'll get better." It never really got great. And then I moved to Jersey the next year. I got to the point where I could work and I could do things, but I always felt like something was wrong. I came to Jersey. I went to see another surgeon down here. He said, listen, before we do another surgery, because you're probably a candidate, and I think this guy gave me pretty good, honest advice. He sent me to physical rehab again. He sent me to a place in Brick. It's not even there anymore. It was right next to Retro Fitness over there. And I went over and I hooked up with these two girls that worked there, and they were great. And they had me doing all these different things, and they really helped me. And it got me into a better place, but it was never right. And then my calf, I started noticing my left calf started getting smaller and smaller, no matter how much I did legs. And I'm like, what the hell is going on? You know what I mean? I think they severed a nerve, my first surgery I ever had. And, I think the atrophy it caused because, you need that stimulus from the nerve to go to the muscle, to tell the muscle to grow. And I don't have that anymore. And I don't think there's any fixing that, right? If it's severed, right? Someone told me that your sciatic nerve grows back at the rate of 1 millimeter a month.
No, so nerves grow back very, 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 very slowly.
Right.
But if you outright cut or injure a nerve, then no, that's not coming back.
I'm pretty sure that's what I've got going on.
You're talking about pressure on a nerve or irritation of a nerve. Yeah, that'll kind of heal. Right. If you're just outright cutting, no.
I think that's what happened to me because I don't think it severed when I jumped off the thing. I mean, I wasn't even in pain till days later. So. Yeah. So I don't know. I always say that's at least my theory on it. And then I came down here, and then I started experiencing more pain, maybe 5 or 6 years ago, something like that. And I went to go see Dr. Bashir that I was telling you about at JFK Center in Edison. And he did pretty much the same surgery over. He didn't want to cage me. I went to see a doctor down here that wanted to go through my stomach and put a cage in. And I was
cage would be a fuse?
Fusion. And I was like, Jesus, I'm thinking I'm going to have a big scar on my stomach. I was like, let me go get a second opinion. So I went up to see this Dr. Bashir at JFK, and he said, no, we'll save that. Maybe one day you'll need that. That's too much. So he basically repeated the same thing. I had an L4, L5 discectomy and an S1 decompression. And then because I had all this numbness and tingling and pain down my leg, I went to see another doctor and did a nerve release in my leg where he made, I don't know, maybe I might have 6 incisions on my leg where they try to, I guess it's pretty much burning those nerves or whatever.
Is that radio ablation? No.
You just said 3 different possible surgeries.
Yeah.
We're going to clarify
here.
There's
4 things that could be. I know what the back stuff was.
The discectomy, the decompression, you're familiar with those, S1 decompression.
No, I got all the back stuff. The 6 incisions can be 8 different things. I don't exactly know what you had there.
He called it a nerve release is what he called it.
I mean, if you say that.
What else did he do?
Were you awake for all that?
What'd you sign up for?
No, if you have entrapment of some of the peripheral nerves, you got a funny bone, right?
Well, I had a nerve study done prior to this where they put all
you had an EMG.
They do the conductivity between and it came back really bad. I remember the guy was like, holy shit, you got a ton of nerve damage. And then I thought it was called a nerve release surgery.
I mean, it really could be.
Or ablation.
No, it could have been. But it wouldn't have been ablation.
Perineal nerve release is a thing. A carpal tunnel surgery is a peripheral nerve release, right? There's a nerve that runs from your brain down to your hand. You cut the little thing over it, you've released the peripheral nerve. You can do that in the leg, too. There's all kinds of nerves with names down in the leg that can be released if the EMG shows that it's not that it's bad in your back, it's that it's bad in your leg somewhere. You've got...
Well, yeah. I mean, that's where the EMG, that nerve test you had with the little... That's where it tells us, is it in your leg or your back, right? Like that helps us figure that out. Right, so they must have saw something on that suggested it was your leg, or there was nerve entrapment happening in your leg, which is why they kind of went after that.
Well, I had it done, and it definitely didn't, make it. It might have made it slightly better, you know what I mean. But I still have a lot of numbness and tingling. But I can deal with that, you know what I mean.
Numbness.
It's the pain that I can't deal with.
You probably tell patients the same thing. Numbness, once it's there for a couple years, like that's there now. Yep. Yeah, that's not going away.
And it's bear. I can live with it. I've kind of just become part of my life. But when it, when the pain hits, that's nobody wants to live like that, So yeah,
So when did you get your fusion? You talked to me about fusion.
Yeah. I didn't, but when I'm ready, you're saying? Yeah.
I thought you got it fused. All right.
Yeah. No, I never got a fusion. No. I went to see the doctor. He was more in this area, and then someone suggested going to see Dr. Bashir, and he just said, hold off on it. You don't need that yet. So that's what I did. I'm kind of, I don't know. I'm 3 surgeries in now. I kind of don't want to have any more. Yeah. So
yeah.
Decompression
surgery where they take pressure off the nerve. You've had that 2 to 3 times, however many surgeries you've had. You herniate a disc, presumably what you did when you were a kid. You're 21 years old. Yep. You have the discs, I'm like jelly donuts. They got tough on the outside, really soft in the middle. As soon as you hit it hard enough to squirt some of that jelly out, now there's a little defect. There's always a chance you could herniate again. Right. It'll heal over, it'll scar over, but there's always a chance it's going to re-herniate.
I got
so you were a kid, you herniated a disc, you got it taken out. Presumably at some point again you re-herniated or something. That's the only reason somebody had to go back in to do another discectomy. And yeah, you're for sure young enough. Fusion is the mainstay of old school spine surgery, but 2022, modern spine surgery says fusion is as much the disease as it is the treatment sometimes, because you got 5 mobile levels in the bottom of your back. You bend forward, backward, side to side, they divide them evenly. If I start putting rods and screws and stuff, now the rest of them got to pick up the load. You even have a 1-level fusion. Rate is 3% a year for the rest of your life. You'll need another fusion at the level above it or below it. Yep. So if you get it now, you're 40-something, 3% next year, and not a big deal. That's a low number. 10 years from now, up to 30%. Okay, well, you're still only 50. 30 years from now, almost 100%, you're still alive, still alive with good quality of life. So you want to avoid fusion if at all possible.
Right.
Some people need it. Some people need the cure today, and they say, I'll deal with 20 years from now because I can't live like this.
Right.
That's back to the consumer of healthcare. You're telling me, what are your priorities? What do you want? How bad is it now?
Yeah, no, I'm good now. I wouldn't have it now.
He was like, now that you just scared me with those numbers, there's zero chance.
That's what I just had the discectomy, and that was pretty much the option. It was either fuse or not, and doctor mentioned the same thing. Like you're going to need one above or below. I mean, mine's L5S1, so there's nothing below.
Right.
But you're definitely going to need above. I'm like, I'm going to wait. And honestly, I feel great. I'm glad I did it that way.
For sure.
No, but I mean, I think we talked to you about it, right? Less is more, unless it is out of control. I can't live like this, or I'm pooping peeing myself, or like my leg doesn't work, right? Like short of that, less is more, and I think we both think that way too.
Yeah, and not that you need to undo a discectomy, but you haven't burned any bridge. You do a discectomy, you just go scoop some of that stuff out. Depending how you do it, you really don't burn any bridge for anything ever again, anything in the future. But once you put rods and screws and cages in, there's no taking it out. I mean, you kind of can, but you really can't.
Yeah, understood. Yeah.
What is CrossFit keeps you guys in business, right?
CrossFit keeps him in business.
Yeah, no, more than me, because you'll see a lot of sports injuries and herniations and stuff, and even jumping on this box, that box, like messing up and falling face first. So it's good though. I mean, I applaud people exercising in general, right? I mean, because most patients and most people don't. So I'm not going to fault someone. I'm not going to fault someone for at least getting out there and doing something.
Absolutely. I'm just busting balls. But yeah, I mean, because CrossFit is about how many reps, not about how the form. You know what I mean? Stuff like that. Sometimes that's why I heard.
No, but I've had patients from CrossFit for sure.
Yeah, you rarely do something bad enough to yourself unless you slip and fall off one of those boxes to really need a surgery for it. But you're
more wear and tear.
Yeah, everything.
Pain management stuff, right?
Yeah.
No, everything with good form is good enough for you. There's no such thing as an 800-pound squat that's good for you. But you do it with good form. Hey, at least you're trying to preserve your back and stuff like that.
Right.
But CrossFit gets people active, gets people going. There's nothing wrong with that. But it's more enthusiasm than form. And they're just doing it, and somebody's just screaming at them, keep going, keep going. You're just loading your body in unusual ways, right? You're designed to stand, walk, sit in a certain way, and now you're jumping on an 8-foot box. No one designed that for you to do that,
It's a lot of that fast twitch muscle stuff too. It seems a lot of that snap action stuff, which seems just more probable to injury.
Would you think people that have more fast twitch, like Bo Jackson, remember how he ripped his whole hip off his bone?
That's true.
Is that from being like so athletic? You think, or is just freak accident or luck of the draw type thing?
I mean, people will count. Most common one is distal biceps. You do something over physiological load, you can just rupture your distal biceps. So yeah, that's sort of possible. I don't know about all that, but there's stuff that you can do. You can condition yourself to be so strong that you overload the tendons, ligaments, and stuff.
Can you like that? Like me, like one day I threw a hook and I tore my bicep. Didn't roll all the way up, tiny bit.
Yep.
Didn't have to get surgery or anything. Healed on his own. It took a long time to heal. Like, is that preventable? Is there anything is that just how it goes?
Conditioning, as stupid as the word sounds, conditioning, because the most common ones are Achilles tendon ruptures and distal biceps ruptures. And there's a whole chapter in a book on this, and it's under the weekend warriors, the people who don't do anything, the people who don't stay in shape, and then they go, Tough Mudder's in town, I'll go do a Tough Mudder, and they rupture their Achilles tendons.
All right, that makes sense though. But what about Kobe Bryant torn? You know what I mean? Just freak accident.
Just freak accident.
Yeah,
that was just freak.
Yeah.
There's, you can condition your muscles, tendons, ligaments have no blood vessels. They just survive based on what's around them. The muscles you can condition, you can make them bigger, you can make them stronger, you can cultivate what kind of twitch fibers you have and what you're able to do with them. But the tendons and ligaments, they're just what they're going to be. They're not really going to grow with you the way your muscles will. So that you get disproportionately strong is the wrong word, but you get disproportionately, built up, and the rest of your body's not made to take that. Yeah.
Gotcha.
And you can load it doing other stuff. Not that baseball players are over physiologically, too strong, but certain arm motions, you're putting stress on your elbow that again was not designed for. We don't have the right
Tommy John surgery.
It's exactly what that's about. There's some ligament in here that holds your elbow together, and it's fine for you to lift all day on that and hit people with it, but you're not meant to use it like a whip and break it that way. And there's a study that they did on the Tommy John ligament that says that the average pitch puts 98 Newton meters of force on the medial ulnar collateral ligament, and the breaking tension of that ligament's about 110. Wow. So the average pitch is 98, and it ruptures at 110.
So it's right there.
You're constantly, every pitch,
red line,
you're right at the red line.
Yeah. Wow. That's pretty cool.
Can you talk about PRP and its application and maybe what you did with Frankie? And
actually, yeah. Well, because you guys said PRP is much more studied than stem cells. I think everyone always says you hear stem cells a lot. It's kind of new, But you guys explained to me that PRP is more studied and more. Right?
Listen. So there's not a whole lot of studies about either at this point, right? And that's partially because if you look at ways studies are paid for, it's mostly government funded. The government doesn't really care about this stuff. So there's not a ton of studies out there in terms of both stem cells or PRP.
Wait, the government just sent a couple $1 million over to Indonesia for transgender studies, didn't they? You're telling me they don't care about this stuff?
Unfortunately not. There's no clinical trials for a lot of these things. And that's the unfortunate part too with like PRP, that's why it's not covered by a lot of insurances, because it hasn't been studied all that well. And part of that is because, a lot of there's not a lot of money in it for some of these companies and that, right? At the end of the day, money makes the world go around, unfortunately. And there isn't a whole lot of money in some of these companies to study PRP, right? We know it helps, but at the end of the day, there isn't great
reason
studies.
Because you're harvesting it from the patient. You're not.
Well, yeah.
Lab is. Creating this?
You can't patent that process, right? Because everyone already does it, right? So it's already out there. So putting it through, there's no benefit to most of these companies. But either way, I will say that, like we talked about, that there is better data, in my opinion, about PRP in some of the studies, and that's also why. For instance, right, like the military insurance will cover PRP injections for knee arthritis, right? There's been at least some studies that show that it's beneficial and it's helpful. They wouldn't make that decision unless there was at least some data or some credence to that. Yeah. But no company, no insurance company, no one's covering stem cells for anything. And just, it's a lack of research. Right. I'm not saying it doesn't work. It's just that we haven't studied it to the point that you're going to get broad application, broad acceptance.
Understood. Yeah.
But getting back to PRP, the concept of PRP is phenomenal, right? It's basically draw your blood down, get good chemicals out of your blood that contain growth factors, right? Things that make your body heal, right? So these are like vascular endothelial growth factors, just different chemicals, right? And what they do is promote the tissue to restore itself and improve blood flow. Like he was saying, blood is basically how we heal, right? If someone doesn't have good blood flow down into their feet, like diabetics and this and that, they get a little cut, it's never going to heal, right? So you need blood to heal, right? So by injecting this substance, you're basically promoting increased blood flow, increased creation of blood vessels into these structures that may not have great blood flow anyway. And by bringing that blood flow, which is really bringing oxygen, which really is what heals things, right? It allows for improved regeneration, improved healing, right? So there's a lot of, not theory, but I mean, there's good thought behind why these things would work. And like I said, we in practical knowledge know it works, right? We give patients these injections, we do it, right? And we know that it helps, but you're not going to have, 100,000, patient study that shows it helps, because there's no one who's making money off of it like that, right?
Yeah.
Right.
Who's going to spend, $20 billion to run that study?
It makes sense to me. I mean, shit, vampires drink blood. You know what I mean? But seriously, did like Benjamin Franklin say something about like medicine's going to be in our food and or within our cells or something? Like, it kind of makes sense that your own self's going to heal you.
Yeah, we have very strong potential or ability to heal ourselves, right? And so what you're doing with PRP is basically accelerating that, right? By saying, hey, instead of just getting a few of these chemicals in there, let's just drop a whole bomb of these chemicals in there and see what happens, right?
Yeah, your blood is like you get a cut, it looks red, and you assume it's all just one thing. Your blood is like a clear soup that's full of stuff. And that stuff is predominantly red blood cells, which is why your blood is red, but it's also full of all the chemicals that your body uses to heal itself. And the whole idea of PRP is you go in, they draw your regular blood out of your regular veins, they spin it out, they separate the clear parts from the red parts from the chemical parts, and then they just take out the chemical bit that makes things heal on their own and put them right in wherever it needs to be. That's the whole idea. Your body was already delivering that stuff to that area,
correct,
but not enough to heal it.
And it kind of creates trauma, right?
Well, yeah, I mean, and that's right. So there's part of it that's inflammation, part of it is restoration, healing, right? But that's where, for a lot of acute injuries, right? Like you're talking about acute, meniscus tear or ACL tear or rotator cuff tears, you put this injection at that site, you're going to create inflammation, right? But inflammation creates scarring, which is pretty close to healing, right? At the end of the day, you cut yourself, you're going to scar, but you're also going to heal. So by putting that material at that right location, you can probably enhance that scarring and basically get a result of fixing a torn tendon, torn meniscus, torn rotator cuff, what have you, without necessarily having surgery. So I mean, it's a minimally invasive way to take care of something without actually cutting you.
And everything he just listed is an avascular structure. Rotator cuff muscle has blood, but the rotator cuff tendon doesn't. Meniscus is an avascular organ. It does
right. These are things that don't heal on their own because they don't have blood.
No blood flow, right?
Right. Exactly. So we're giving it to it.
Now, like, I've heard this before, that sometimes, epidurals, they say epidurals, they say it could be the medicine, or could it be the needle that's creating the trauma to bring blood to the area to heal it?
No, so part of it with the epidurals, right? So some of it is medicine, but there's actually been studies where they just inject saline, and so they think that some of it is the just washing out of inflammatory chemicals, right? Like if I'm just injecting, just take a hose and hose down an area, you're cleaning it, right? So that's the same thought process. If you just inject in that area, is that rush of fluid, that pressure, washing away some of the bad chemicals from that area, right? So that's why there is some data that suggests patients even get better with just epidural injections with saline, no steroids, no medicine, just putting saline in there. But at the same time, the steroids are meant to reduce the inflammation from the disc, right? It's, I always joke with patients, it's like God's poor design. Let's put a whole soup of bad chemicals right in the middle next to all your really sensitive nerves, and let's see what happens, right?
Yeah, that's a way to look at it. Yeah, I never heard that. Frankie, I never heard that theory. Actually, kind of does make sense. That the trauma from the needle itself. It's almost like a placebo effect for your herniation.
But like even like I mean, massage. Is massage really scientifically backed? But I think it's just the fact that you got someone rubbing something, it's bringing blood to that area. It's probably right. It probably
Yeah, I mean,
feel better.
That's what happens to me when you rub that area.
Well, no. No, but I mean, that's the same thing with like TENS units, right? Like a lot of people use TENS unit, or you go to a physical therapist or wherever, they put a TENS unit. The electrical stimulation is just improving blood flow, which does feel good, right? Like it heats it up, it makes it feel better, it feels therapeutic. In the long run, has that been shown to permanently heal a previous damaged structure? No, but certainly while you're doing it, it feels good.
Put your body in a good environment to heal.
Yeah.
Right.
What's the one? I call it a TENS machine, but it's not. It's got a different name that they actually implant into your spine.
Spinal cord stimulator.
I had that. Yeah, I did like a 10-day trial.
Yeah.
It was mostly. I mean, I always have a little bit of pain, but it's bearable. It's a manageable pain. But the numbness and tingling was driving me crazy for so long.
Sure.
They thought that they could maybe, sort of tricking your brain. Really is what it's doing, and it didn't work. So we did the 10-day trial and took it out.
Yeah. No. So I mean, so when I talk to patients about that, that's like the best part. That we're like, hey, we're going to test drive this.
Right.
If it doesn't work out, we're not moving forward, right? And I tell patients, like, we don't want home runs, right? Like, you're not going to convince me to put this in you unless you come in here saying, oh my God, that felt amazing, right?
And I had the rep from the company was great. She used to talk. I used to talk to her all the time, and she could sit at home with her laptop and like adjust this thing, So we did it at like pretty much every possible setting you could, and I really didn't notice any difference. I think some days you wake up like really hopeful, and you're like, oh man, and then
but most patients are kind of in your shoes. They want this to work, right? So they're going to give it a fair shot. They're not like writing it off right off the bat, right? And that's why I tell most patients, like, hey, my job is to give you this option, but at the end of the day, it depends on if it helps you or not, right? Correct. The majority of patients, we know from studies, most patients, 7 out of 10, 8 out of 10 are going to move forward, but every 2 or 3 don't, right? And unfortunately, your case,
they said it would. They felt a lot more confident if I was strictly dealing with pain. Pain wasn't my biggest factor. It was more the numbness and tingling.
No, but those are never. It's never going to make numbness go right. Like I just told you, if you have nerve damage, give it a couple years. If it doesn't get better, it is lifelong.
That's
unfortunately, it is what it is. Yeah. But so those type of stimulators are never meant to really improve numbness. Or unfortunately, almost nothing improves numbness. Right. Certainly, if the tingling was there, but it was painful tingling, then maybe it would have been improved. But most patients are kind of like, especially when they have numbness, they're like, you know what? It sucks. I know it's numb, but at least it doesn't hurt.
Exactly.
Right.
That's kind of how I view it now.
And so in that situation, then I would have probably not even offered you that. I mean, like, you know what? Then it's not going to do what you kind of want it to do. No stimulator is going to get rid of that numbness. No stimulator is going to get rid of that like mild tingling that you feel.
Right.
Now, if you were having pain, that's why you would use it.
Yeah. Yeah, they kind of gave me that. Maybe at the time, this was years ago, maybe I did have some residual pain, but it's never been, other than when I had that first surgery done, that was the most excruciating pain I've ever been in my life. But with the exception of that, it's all been sort of bearable, sort of manageable. It's just annoying.
Yeah, but I mean, listen, and I think he brought that up earlier is that, what's your goals, what's your quality of life?
Right.
You got years and years ahead of you, right? So you don't want to get super aggressive at the age of 30 and 40. That's just going to be a bad spell down the road, right? Like you're going to have more problems. So as long as you're tolerating what you want to do, you're doing what you mostly want to do, you don't want to get too aggressive too early, right? And so it's hard for most patients because, you need guidance in that. But that's where forming a relationship with a doctor who knows you over the years and says, hey, look, you're now at a point that you do need this, right? But before normally they're the ones saying, no, hold off. But that takes having a good relationship with a doctor that you trust, right?
Yep. Yeah.
What do you guys feel about acupuncture and chiropractic?
Well, I mean, I'll give you my 2 cents. So there was actually a big study that was done in JAMA. It was like 2016. Looked at it was called a meta-analysis that looked across all these different studies, put together like 30,000 patients looking at chiropractic care. So in acute chiropractic care, that study looked at and said it was about the 50-50 club, right? 50% of patients got better 50% of the time. The one take home I got from that study was that no one got hurt, right? Mm-hmm. Like, so at least for acute low back pain, it's for the most part not going to hurt. You have a pretty good chance of getting some relief. And that's also because, with chiropractors, it's a lot more of things they do to you than physical therapy or working with a trainer where you're doing most of the exercise, you're doing a lot. So especially when someone's kind of like flared up and just, it's too painful for them to move, I'm like, just go see a chiropractor, let him put some heat on you, let him put some stim on you.
Do you know who started chiropractic? You ever hear about that?
No.
The guy that started chiropractic learned it in a seance.
Oh, really?
In a seance, yeah.
So who in the seance taught him? Like which spirit?
I don't know.
Yeah.
And he said he could cure deaf people with it.
Yeah, no, I don't believe that.
There is good literature on acupuncture for whatever reason for back pain kind of thing, and it's one of those things that all studies. And if you listen, every time you ask a question to which there is a real answer, one of us is saying, well, there was a study that showed, because even the smartest doctor just knows what other people have researched already.
Right,
That's sort of what it is. Yeah. But there's two ways to do research. You can say, hey, I'm going to do a thing to you, and I'm going to follow you. I'm going to get x-rays to see what it looks like in 2 weeks, 4 weeks, 8 weeks, 12 weeks, and see what it looks like. And the alternative is to say, I did something to you. How do you like it? How do you feel? Yeah. Where maybe nothing inside of you had to change, but suddenly you feel better.
But it's like causation or correlation, right?
Yeah. So medicine is changing. Old school, 20, 30 years ago, the only thing that matters is progression on x-rays. If I do something to you, does your bone look better on an x-ray? And that's for broken bones, that's still the case. Right. But for everything, we used to just say, what does it look like? Does it look like it's getting better? Damn, I'm good. I did that. It looks better. Medicine is getting away from that because I can do a hell of a fusion and you could still be miserable. And I can just say, your x-rays look great, but you're still miserable. So we're switching perspectives-wise. And so the big study on acupuncture didn't ask, did we increase vascularity in the lower back? Did we increase the way your nerves are responding in your lower back? It just said, are people happy after they got it? Yeah. And the study in acupuncture said, yeah, people with low back pain get better with acupuncture. They have no idea why. We're not investigating why. They were just happy.
And I wonder how much of that is them just getting better over time anyway. You know what I mean? I wonder.
Yeah, it could be. Or,
well, I mean, there's also
a placebo effect. Right?
Yeah, I mean, everything has a placebo effect.
Sure.
But I will say, if you look at some of the acupuncture locations, they do sit near something called neurovascular bundles. So even these people thousands of years ago figured out where our nerves and our blood vessels come together. And that's actually where a lot of the acupuncture points are. So there is some science behind it, right? Like that even then they knew that these are certain areas where parts, like integral parts of our body come together.
Okay. I was explaining acupuncture as there's 12 channels of pain in your body. Say this channel 3 is just really, firing, bothering you. You take the acupuncture, the needles, and you take it from this one, you spread it among all 12 channels so that 3 gets dissipated among 12 and it's bearable. Does that make any sense?
I think you're the expert on this.
Yeah, I will say I skipped that lesson.
I'm not a voodoo guy, bro. That's the thing. That's why,
No, but I mean, so there's some scientific base. Like I said, so acupuncture points are near neurovascular bundles, which we know transmit a lot of pain and different things like that. The other part of it is just the physical act of putting a needle in can be very relieving, especially in tense muscles, right? So that's why exists dry needling.
It's almost like trauma then too, right? Yeah.
Well, I mean, especially if something's really tight and spastic, putting a needle in, you can break up some of that spasm, right? So that's why they used to allow dry needling, where not even injecting anything, just take a needle if something's really tight, spastic, just put a needle in. And I even do it, even when I do, give someone trigger points or something like that. You'll elicit a spasm if the muscle's really tight.
I'm doing it right now, and I almost always get a muscle spasm.
Yeah, you'll see it, right? And that's that's when muscles have what's called myofascial pain, right? So basically, when muscles are healthy, they're very loose, limber, they can stretch, they can move. Over time, if they've especially been beat up or used in ways they're not supposed to, they get real tough, tense, dense. It's almost like, veal versus steak, right? Yeah. And so when you get to that steak point, a lot of the connective tissue on top connects these muscles in ways they're not supposed to be connected. And so a spasm in one area can kind of propagate down in other areas. And so by putting in that needle, you kind of break up a lot of that connective tissue connection. So that way those muscles can start to work independently and kind of relax again. But that's why when that's almost like what you're looking for when someone's giving you trigger point injections. You want to see that release of that spasm from putting in the needle.
And they couple it with the TENS machine. They actually hook the TENS machine up to the needle.
Oh, so you're talking about pens, right? So you're talking about percutaneous electrical nerve conductor, right? So they put the little needles in and then connect the TENS unit up to
And
I was just calling it acupuncture because I thought that's what it was, but
Then
close enough.
The chiropractic stuff, if it just like anything in life, it makes you feel good, do it. There's no harm in doing something, especially if there's a licensed qualified professional who says, "Hey, I'm going to do this to make you better." That's really all that I say.
Yeah.
I'm qualified to tell you this is going to make you better.
No, and that's why I brought up that study about chiropractors, right? Like, hey, 50-50 club, but no one got hurt.
Right.
So at the end of the day, and I tell a lot of patients, look, if it helps you, go. I don't have all the answers for everyone. You know what I mean? So if you found something that helps you, whether it be over the counter, as long as it's not illegal and not a illegal substance or whatever, then go ahead, use it. I don't care, as long as you feel like it helps you.
I don't know how much it helps me. I think I look at it like this: when I am trying not to view another surgery as an option, although one day it might be. But like you said, I'm still relatively young, so I look for options. When time doesn't seem to fix my issue, my back pain, which I was like 2 years good, maybe even more, 3 years good, where I really had very, very little, and then the last like 3 months. So instead of going to see a surgeon, I was like, let me go back to my old, chiropractor, and maybe it's just buying me time. I don't know, but I don't walk out of there and I'm not like, oh my God, I'm so much better. But like, I feel like I'm being proactive and doing something. Sure. You know what I mean? And I do the acupuncture. Probably it's all in my head. I'm like, if we can stimulate something in this leg, let's do it. And I know it's never going to happen, but.
They can do implants.
calf implant. Yeah, hey, maybe.
You be like Johnny Drama?
Might be. Yeah.
That's right.
And it just speaks to changing priorities in healthcare. That's why there aren't billions of dollars of studies into PRPs, because what did your grandfather do? He just worked until it didn't hurt anymore or until he died. Like, those were his two options. Right. And medicine of that era was just like, well, this guy was on the rail line and he finally can't work. So what do we got to do? We got to hit him with everything, big surgeries. You got to make him better because he wants to get back on the rail line. Well, that's fine. Our healthcare priorities are changing, though. People are younger. They say, hey, I don't want to just be miserable and work forever. I kind of want to feel a little bit better for my 50s or my 40s. Right. Your grandfather didn't care about that, No. And so research efforts have to change priorities. Wasn't
some of that, too? Life expectancy is now a little bit more than it was then?
Yeah.
So,
well, I mean...
You don't think so? It's constantly getting higher.
This year is the first year it went down.
Oh, well, because
COVID.
Yeah.
COVID and opioids.
No.
I'm jumping on that.
COVID and opioids.
Yeah. For me, I'm
people
jumping on that.
The biggest reason people are citing is possible socioeconomic issues. You can look by zip code and change your expected longevity. Right, you go to a quote unquote bad neighborhood, the life expectancy isn't as long. Why is it violence? Is it people hurting each other, or is it just that they can't afford to eat well, and that's what's killing them in the long run? And so everybody's poorer than they were last year, and everybody's lost their job or whatever. Makes sense, and big picture, that's probably as bad for anybody as a disc herniation is.
Sure.
You lose your main source of income. You can't eat right. You're not.
As a nation,
vegetables are expensive.
We're definitely less healthy as a nation than we were years past, for sure. Right.
For sure.
Oh, patients coming into the office every day, blood pressure out of control, blood sugar out of control.
Okay, so what do you think that is? Is it because our diet's so bad?
No, I think with COVID over the last couple of years, people have been not going to their doctors, not taking care of, right? Like, everyone's at home, depressed, eating whatever they want, not really exercising. So I think over those 2 years, it's catching up to people now, right? Like, that's where we see it, right? Like, people, they're not complaining anything. Walk in and blood pressure is 180 over 120. Whoa, what's going on here? Right. You know what I mean? And, I haven't seen my cardiologist in 6 months. Yeah. Everyone, so it's important now that we caught a lull, and I think we got a good solid 6, 7, 8 months ahead of us where COVID cases should be down. And I encourage all patients and people, get out, go see your doctors, go take care of what you need to, and try and get as healthy as possible right now.
What about me getting on the adrenochrome kick? You guys are promoting the properties of blood. Should I go start sucking the blood out of babies? Is that good, or?
I don't even know what you're talking about.
I think you're the expert on that one.
Yeah.
We just had our good friend Jesse. We just had dinner with him tonight, and he would go on for an hour about adrenochrome.
Conspiracy theories type stuff.
Yeah. You guys really have never heard of that?
No.
You don't want to.
No,
don't look it up. Don't look it up. Don't look it up.
What's nuts is that PRP. I said blood is clear soup. There's clear parts. There's red cells, and then there's just, they call it the buffy coat, or the white layer in between. It's where everything is. And even PRP injections is basically nothing but, we're going to take that whole white layer where we know some of the good stuff is, and that's all we can give you. We can't distill down just the best parts of that layer to give you. All we can do is say, this is the good part, this is just red blood cells, this is nothing, this is where all the good stuff is. Gotcha. I can't be any more specific than that. I can't pick out a one thing out of that. If I need to give you something so specific, I got to grow it in the lab and then give it to you. There's no way to get that out of you, at least so specifically.
But these chemicals, we're talking about, like, infinitesimally small chemicals, right, that you can't even harvest or grow, you know what I mean? So it's not practical to harvest like blood or something like that, right? These are small components of blood. So it's almost impossible to get otherwise.
There'll be one molecule of it in a vial of blood.
Now, Could you get PRP from someone else's blood? Is that possible?
I mean, you can, but you wouldn't want to inject it. I mean, because it's not cross-matched. It's not. It would
have.
React.
It would probably be hard to
Oh no, you would.
it.
You would react. I mean, you would have
no matter what. Okay.
Yeah. That's why the whole beauty of PRP, it's got to be your blood. But that's why unfortunately, some people who are eliminated are like cancer patients, or they have leukemia, lymphoma.
Oh,
right?
Like
you're not
their blood's not.
No,
good.
yeah. If your blood's not good, you're not a candidate. We're not doing this. Yeah.
Even if it was the same blood type.
Yeah.
No, I mean, because it's not checked. No, there's no capacity to check it.
Blood type is the one biggest and easiest to measure thing that we can use to say your blood's okay to go in him. But below the blood type, there's 100 more things that are possible incompatibilities. Okay. But you know what? If you're dying, we got the big one. Right. You give it the rest of it. Will sort itself out.
Yeah, exactly. Got it.
But this is like totally elective. Like, hey, we don't need to do this.
Yeah, right.
Why give you a possible deadly allergic reaction?
Yeah. Understood. Yeah.
Because that could happen. You could.
No, of course. Yeah, if I drew his blood and injected it in me, of course.
Wow.
Yeah, it would not. Yeah, it would. I mean, I don't even know what blood type I am, but
literally every single thing in your blood has some kind of antigen antibody reaction that's for you. You give it to somebody else, it's going to have some kind of reaction. Wow. The red cells, which is usually what you're getting a blood transfusion for, they mostly stick to the one big thing, the blood type. But everything in there has a possible, reaction that somebody can get, which is why you can get a cross-matched blood. You can get blood that's your type in the hospital when you need it and still have a reaction to it. That's why when we're in the hospital, what they'll actually do is they basically just take the donor blood and your blood before they give it to you. They put it in a little petri dish and watch what happens.
They double. Yeah, so if you're actually if you're going to do some big surgery and you're like, hey, we're going to need blood for this. Like, I know I'm going to transfuse this guy. If you cross match them for blood, they will literally take a piece of that blood and the other blood they want to donate and mix it together and make sure nothing happens.
Yeah.
Wow.
And then they label that and send it to your operating room and say, hey, this is the blood for this guy if you need it.
Let's say there is an adverse reaction, then they just try a different sample?
Yeah, I mean, so you basically just stop what you're giving, treat whatever's going on, and then, go to like universal donated blood or whatever. But but I mean, that's why when you specifically ask for something called being cross-matched for blood, they will cross the two bloods together and make sure there's no reaction and then deliver it to that operating room to be used for that patient.
Wow.
I'm hearing there's a blood shortage right now. I get my little Red Cross notifications.
Oh, I'm sure there is,
There's a massive shortage going on, supposedly.
Nobody's going out and donating blood because everybody's staying home.
Right. Makes sense, yeah. Yep.
What's the O positive is the most popular one? That's what I am. Yeah, I think I am.
A positive.
A positive.
Samir?
I don't even know what I
I didn't know for long. I didn't know.
I didn't think about it. I was like,
I only know because of my Red Cross app. That's the only reason I know.
I didn't know for the longest time. Renee made me get it checked.
Yeah.
Yeah.
So let's talk about you. You were the patient. We have the doctors here. How's the shoulder feeling? And when could he expect optimal results? Is it pretty much immediate?
No, it's like you're kind of in the window now because it's been like 3 weeks. It's like 3 to 6 weeks.
I mean, I'll be honest. I'm gonna be honest. I've been doing everything with my shoulder the whole time. No,
but that's okay.
We know.
Actually, I haven't even followed up with you. How is it feeling?
It feels pretty good. That first day it hurt.
No, but I mean, so when we inject, so PRP, when you're getting an injection of PRP, it's acidic chemicals.
I'll tell you.
So it's basically I'm injecting acid into your joint.
Yeah.
Nobody likes that.
Yeah, he's prepping me. You ready? I'm like, yeah, my shirt's off. I'm ready. And he's going. He's halfway through. He's like, I can stop now. I'm like, just give it to me. Just give me the fucking thing. And he gives it to me on.
Not the first man he said that.
No, I will say. I mean, he took it like the champ he is.
Yeah.
And
that's what he does. That's what he does. That's what he does best.
And then you can go ahead.
I try. And then I'm getting up, and I'm like. He's like, you're all right. And I was all right. I'm not trying to be a bitch. You know what I mean? So I'm like, yeah, I'm good.
Tell him what you really said.
No.
To Renee. Tell him what you said.
No. Well, then I'm like sweating. I'm hot.
I could see he was sweating. I could see he was sweating. I could see that
he's like, let's take a picture. He's like, can we take a picture? I'm like, yeah, let's take a picture. And I'm like, Renee, stand close to me just in case I was going down. I need to grab her, you know? And then I said, hey, let me sit down. I put the ice on. And I had to coach my kid that night in the wrestling match. And I was all I kept thinking, I was like, how the hell am I going to coach my kid? But literally an hour later, I was fine.
No, yeah, it's just that immediate surge of pain from it's basically acid being injected in.
Right. But
so, I mean, you're looking at probably 3 to 6 weeks to sort of see full benefit.
Yeah. No, I feel pretty good. I'm feeling good. it's clicking less. It was clicking, I feel like it's clicking less. So those are all good things.
Mm-hmm. Yeah, I mean, when we're really evaluating was that a success? I mean, sometimes you use things like, hey, is the pain better? Is it 50% better? Is it not? But I mean, ideally, you see functional improvement, right? Like, hey, I can lift more, I can move more, I have better range of motion, I have more strength in it. And so that typically takes a little bit longer to see kind of that full benefit.
So what did you say, 3 to 6?
Yeah, in general, you're looking at 3 to 6. But I mean, and you're looking for about, at a minimum, like year to year and a half of improvement, right? So this is not something that can, typically is lifelong, but you can certainly see better duration of improvement over steroids or other injections.
Gotcha.
Right. And there's no limit on how many PRP shots you can take.
I mean, it's right. That's the beauty of PRP, right? It's not a exogenous substance, so it's not something else from your body being put in, right? It's from your own body. Because of that, you almost have no chance of infection. It's your own body. You have almost no chance of rejection. It's your own body, or adverse, side effects, right? It hurts when it goes in, but other than that, it's not dangerous in any way, right? Outside of patients who may have leukemia or cancer, right? Like in that situation, you don't want to possibly spread their cancer by, injecting different body parts. But outside of that, it's a very safe treatment, and there's no limitations. And, it is
It has a lot of different applications, if I'm not wrong. I got it in my head for hair loss.
You can.
Yeah.
So, no, but I mean, that's the same thing. Rejuvenation.
Not for your smarts, not for your reading.
She's not here.
Couldn't turn that one into a gay joke?
She's not here, but we have a doctor who does that too.
Okay.
No, but you can, right? So it's all rejuvenation, right? So rejuvenation for hair loss. That's what a vampire facial is, right? They like microneedle your face and then dump PRP in front of it, so that way you can sort of freshen up your skin. So there's a lot of applications for it across all spectrums in terms of rejuvenation of whatever body part.
And when did this PRP start getting popular? I think I started hearing about it probably
when Kim Kardashian posted that vampire facial she had done.
that was PRP.
That was PRP.
No, but that's what vampire facials are. Yeah. You microneedle like the face, get some pores open, and then you just dump PRP on it. Oh, wow. And that gets into the skin and helps rejuvenate, right? Improves blood flow, improves elasticity.
You're no stranger to getting stuff dumped on your face.
This guy.
I'm on a roll now.
This is a bad night for you.
Listen, at least I can smile and make expressions on my face, pal.
That's when you're doing most of those expressions.
Yeah. You make the same expression.
But I was going to say, I mean, I knew a little bit about his history, but hearing your history, if you've had a stim trial, you've got some back issues, right? Like that's not something you're doing.
I even
had
PRP in the calf back, and I was like, let me throw everything at this, see if there's any hope. Even though I kind of knew, I was like, this thing is dead. Like, I'll show you. I'll stand up and show you. You can see what I mean. I'm not making it up. I mean, I call it my gimp leg. I've called it my gimp leg for years, but you'll see the size of it straight away.
Let's see.
I mean, keep the pants on.
That's my normal calf.
Wait, your right one's your skinny one?
Wait, the right one's a good one?
You got jokes. Yeah. I have no interior calf.
Yeah.
For sure. Not symmetric.
The outside calf looks great.
I think it overcompensates, for the inside calf. But yeah, so I threw everything but the kitchen sink at this thing, thinking like anything that might stimulate this nerve. I was always in hopes because I always heard that number, 1 millimeter a month. I don't know if that.
No, but I mean that's not if you have like true outright damage.
I got 5 more years and it'll be down there. No, I never.
No, so
is that what you give Jim? Is that what you give your ex? 1 millimeter a month.
Okay.
I'm probably gonna get sued for that one.
You can actually, to that point, you can actually have what we call an iatrogenic nerve injury, a during surgery nerve injury. Guy sneezed, hit something wrong, right? That's when they talk about a millimeter a year. If I take a 4 millimeter instrument, which is a common size instrument for surgery, and I bang down on your L5 your S1 nerve for what you got a 4 millimeter injury. You can count on maybe a millimeter of growth repair over that period, over that length. And you say, hey, if I hit it just with this 4 millimeter thing, maybe in 4, 5, 6 months, you'll be better because maybe it was able to repair across that distance. But if you're 6, 12 months out and that's not better, that's not
probably
been
completely severed then, right?
Yeah. Or this is common in the upper extremity. There's like 1,000 nerves up here, right? Everything that makes your hand work. You can have a segmental injury, cut by a pane of glass, cuts out a half-inch section of nerve when you get cut up by the glass. That will heal at a millimeter a month. That's what's going to put that back together. But if it doesn't make it, or if it doesn't do the trick, you're done. You know, if 12 months go by, that's the maximum you can hope to get out of that.
I've accepted it at this point in my life, you know, but there was a period of time where I was like, I'll try this, I'll try it. So I did do the PRP in the leg, and, you know, doctor said, hey, maybe worth a shot. You know, we did it.
Right.
But yeah, no. So I think it's there. So I just have to be comfortable with my baby calf at this point.
Any regrets jumping off of the cliff?
Yeah, I'm too old for that crap. I've
jumped off of one cliff in my life
really?
When I was in Jamaica on spring break.
Oh, the famous one. What's the name of that one?
It was like at Rick's Cafe.
Yeah.
So I jumped off that.
Yeah. If you go on
never
YouTube,
again. Never again.
If you go on YouTube, you can actually like put in Rick's Cafe or whatever. You see the people that get scared like halfway and try to catch themselves, and they get all messed up.
No.
They're like committed, and then they go to step off, and then they try and they get all beat to shit.
I had a bunch of shots, and then I jumped off that cliff, and then I looked up, and I was like, never again. That was a terrible idea.
That's actually pretty high. I mean, what is that, 50 feet?
No, I think it's like 40 or 50 feet. Yeah.
It's pretty
Dude,
significant.
one of the girls we were on this trip like just cannonballed it, and she was just bruised up like the whole side of her, like the whole. She was like wearing a camisole the whole time because she was like so embarrassed by her bruise up and down.
It's decent. And I see some of the local guys go up in the trees next to it. Jump out of the trees.
Yeah.
They're even crazier.
Yeah, but they've probably been doing it since they were like 4.
Exactly. Exactly.
So now you guys, how long you guys been at the Garden State Medical?
So I've been there longer. I've been there 5 years approximately at this point. So like I said, I went to school out in Philly, went up to Boston and New York to do training, and then Jersey's always been home. So I moved back to Jersey. I was at a different practice for a little while, and then have been here since 2017, and you know, no intention of leaving. At the end of the day, it's a practice where you know that not only the doctors but the staff are really there to help take care of people and really help be there to make people better, which is what is important when you're looking for a practice that you want to be at for a long time.
For sure.
And like I said, I grew up in Union County, and I left a long time ago. I was in Philly for probably 10 years, Baltimore for 5 years, LA last year, and then I'm fresh back. So I'm happy to be back, happy to be home. I've been at Garden State a little less than a year, but the best thing I can say is that the doctors here like it. The patients like the doctors. People are doing the right thing. It's so easy to see. You say, well, I'm going to do the right thing, and my partners can do whatever they want to do, but it's not that. You know, these guys, there's plenty of chance to be crooked doing anything, and everybody around me is doing the right thing all the right time. Yeah. You could, especially as a surgeon, you can do bad stuff all the time and get paid for it. There's none of that, and that's, I think, the biggest thing about it. The reason I like it.
Yeah, you know, when I went down there and we spoke even before I got the PRP shot, I just kind of, you never know who is who, and picking your brains, I could tell you guys are sincere and take your profession seriously, and I felt comfortable. Obviously, I was happy I got that done. Definitely feeling good. So happy to get you on the podcast. Maybe you could fix Roger's head a little bit for me. I don't know if you guys.
I think he's got more. I think it sounds like he got more problems than just his back.
Yeah, just his gimp calf.
Yeah.
They call him Biggie Smalls.
I got to. I think it all is. What do they call it? 6 degrees of Kevin Bacon, where everybody's intertwined in some way. But Jen, who's off camera, I got to know through Instagram, and her story was so inspiring. I actually talked about Jen on the podcast many moons ago, and I think Jen ended up reaching out to you. So it was a great connection for you because
for sure.
you had that shoulder that was bothering you. So
absolutely.
Yep.
No, we're absolutely lucky to have her. She's put us into connection.
Yeah, she's great.
You guys,
definitely.
and so it's been we're lucky to have her.
So we're I know Garden State Medical has an Instagram, right?
They do.
Yes,
that's Jen's job.
Yeah,
it's Jen's job.
Garden State Medical.
It's clearly not our
Garden
job.
State Medical. GS Medical.
Okay.
GS Medical on IG. Number, got a number or anything?
I know the number, 732-202-3000.
Yes,
yeah.
for all pain and management.
For pain or orthopedic issues.
Yep.
We also have a rheumatologist who works with us. We also have a doctor who does functional medicine and does, PRP for facials and all that kind of stuff too.
And so anybody that was experiencing any of that could set up a consultation.
Oh yeah,
come
absolutely.
In. How
about hard-ons? Do anything for hard-ons? Rogers wants to know.
Can you guys do anything for that?
You're on your own. But with the having all those doctors under one roof, the nice thing is, I've seen stuff that I can't fix, and I just send it to these guys.
Right.
They see something that we can fix, they send it to me.
Yep.
Vice versa with the rheumatologist. Rheumatologist is like our guys. Rheumatologist in general is the smartest people I know. This guy just happens to be the nicest guy we know. I send in patients all the time because I say, hey, I'm going to fix this, blah, blah, blah. But they need like a life tune-up. Like he's the guy to check in for that. So it's great to have all these doctors who
bounce stuff off of.
Yeah. Yeah, and
it's huge.
We can't cover everything in all of medicine, but anything that starts with an acre of pain needs one of us who work here.
Right.
Sure.
Right.
Not here.
Yeah, not here. You don't need me. Well, guys, thanks for coming on.
No, this was awesome. Thank you.
I hope we don't have to see you, but if we do, we know we're in good hands.
Yeah.
Well, you know where to find us.
Absolutely. Thanks, guys.
Thanks again.
Pleasure,
Thank you.
gentlemen. Thank you.